So I wanted to talk to you about two main areas today. One was about kind of where we are with public health and all of its problems, and then the other is your expansive efforts at YLE, which is your local epidemiologist. So let's start off with today. We got the news, of course, that the CDC nominee Weldon was no longer going to be the nominee. I take that as good news. What do you think?
Yeah, he kind of came out of nowhere. I mean, he was really prominent on the scene in the early 2000s. And when he was nominated, everyone was like, who's Weldon? And so I was actually very curious about the hearing today because I really wanted to figure out, like, who is he? Like, what does he believe in? All that sort of stuff. And then you're right, it was pulled right before. He put out a statement on that PDF. I don't know if you saw that, Eric, around them pulling his nomination, and how frustrated and angry he was that it was pulled because he's been labeled anti-vax, and he's I don't know, so I yeah, it's a good, maybe a good thing if you continue to be anti-vax. I'm not too sure. I'm kind of holding my breath because there could always be someone
Yeah.
worse, I think.
Well,
So I think, like, we're right now, it's an interesting development, but the story hasn't finished yet. So we'll see how it plays out.
exactly. It's hard to imagine it could be worse than RFK Jr. in some respects, especially the way he's reacted to the measles outbreak in Texas and New Mexico with his ideas that the vaccine was causing it and cod liver oil and all these other things. And, it's interesting, of course, that he's in there and he's, of course, already changing the way he testified when he was up for nomination. So it's very worrisome. So maybe we can just talk a bit about the measles outbreak and your thoughts about that, because we've got probably hundreds more than haven't been surfaced as far as the 250 plus as of Tuesday this week. And this is obviously well outside the Mennonite community, getting into all sorts of counties in these two states. Where is that headed, do you think?
Yeah, so you're right. I mean, it's still continuing to grow. Yesterday, is this yesterday? Oh, tomorrow we're going to get a count update again from Texas Department of Health and New Mexico. But on Monday or on Tuesday, whenever the last update was, it was still growing. And you're right. I mean, it is likely much bigger than the numbers that are being reported, and that's for a number of reasons, including it's these are tight knit communities. There's a lot of mistrust in government institutions. There's a lot of behavioral changes when an epidemiologist comes down and parachutes with a clipboard. But also, it's the numbers are just not adding up for me. And I wrote this in my newsletter earlier this week, is that there's been 2 deaths now with 255 cases reported. That usually we see 1 death per 1,000 cases in unvaccinated. So either these two were incredibly unlucky individuals, or, which I think is more likely, it's a much larger outbreak. And given what we're hearing on the ground for the measles response teams, it seems like it is bigger than what's being reported. How much bigger, and will we ever know? I don't think so, but it is very clear that it's taking a lot of resources, and this is not a good time to be defunding or destructuring public health right now.
Yeah, I mean, that's what we have, the worst measles outbreak and the first deaths, for many, many years. First child for, I think, in 22 years. And then we have a poor response and poor, I mean, what RFK Jr. said about making vaccines a matter of personal choice, no less, these other remedies that he's advised, like cod liver oil and vitamin A. It's really sickening as to what is the difference between evidence, a major outbreak, which of course could get much worse. Yet, yesterday we saw somebody in LA who had been at LA International now is diagnosed with measles, and who knows where that's headed. What should be done right now? If you were running the show, which I wish you were, what should be
I don't
done?
think anyone needs that. I mean, I think the number one thing, and I don't know if anyone's going to be surprised about this, is communication and transparency, right? The last two big measles outbreaks was in Disneyland or in California. Disneyland was the hotspot, as well as New York. And that was an all hands on deck response. We were hearing from the Surgeon General, we were hearing from the HHS Secretary, we were hearing from the CDC Director. I mean, it was a communication is key in crisis like this, and bringing people along for the ride, but also being responsive to the questions and the needs on the ground. And it's very unclear, like, for example, how many people have been vaccinated with MMR in Texas, right? And there was a Chicago outbreak last year, and the Chicago, the state of Illinois was incredibly great at giving counts of how many vaccines they were given every single day, and it really tampered down anxiety because it felt like there was something being done about it. And so I think communication, transparency, and is key. I think the other thing I would do, the first thing I would do, honestly, is partner with trusted messengers in the community. I brought this up a little earlier that, like, an epidemiologist parachuting down with a clipboard, I mean, no one's going to trust them, and they shouldn't, right? Like, you're not me, or we don't know you, kind of thing. And so, how, like, activating the faith-based leaders, activating those pediatricians, equipping them with the things and the questions and the tools that they may need to guide the community into making evidence-based decisions is, I think, the thing that we should be doing, instead of this top-down trickle hoping to eventually reach the households. And so yeah, I mean, it's hard and honestly just sad to watch, because I'm a parent, right? I have a 4 and 5 year old crazy girls. And, like, as a parent, it's already incredibly confusing of how to make choices. I mean, we're just trying to do what's best for our kids. And if there's this storm of information, especially with a mouthpiece coming from the HHS secretary, I have a lot of empathy right now for parents just trying to figure out what to do and who to trust.
I couldn't agree with you more. Also about older adults, what would you say about getting an MMR at this point for people? Is that something that should be considered, particularly in regions that are in jeopardy?
I'm actually writing a newsletter that's coming out tomorrow about this, because I'm getting so many good questions
Yeah,
again. No, I mean, the evidence right now, these outbreaks are happening among unvaccinated people, and they continue to. Um, it's pretty incredible how well these MMR vaccines work, how durable they are. I mean, you just need 2 doses when you're a kid, and you're protected for a very long time. I mean, that's it feels weird after COVID, right? Where you needed many different shots, but there's just a different type of virus. I know. So no, I don't think there's a need for a booster. There is a specific group that would, and that is, I need to pull them up. I was just writing
I think
about
it's
this,
before
but it's like,
1958, born
okay.
1958, which I'm in that group. So,
Oh,
yeah.
there you go. So yeah, I mean, I think between that time period, yeah, you should go get a booster. Um, the what was I gonna? I just lost my train of thought. But oh, the other question a lot of people are having right now is titers. Like, should I go check my antibody levels?
Mm.
And the I am saying no. And the reason for that is antibody levels are just a small piece of the immunity protection. We have B cells and we have T cells as well, that those titers won't pick up. And these B cells are actually incredibly important with measles, because measles actually, once you're infected, it replicates a lot slower. And so your B cells can actually be activated and help a lot faster than, for example, with COVID or flu. So yeah, pay attention to my newsletter coming out
Oh, yeah. And
tomorrow.
by the way, somebody was asking in the chat about pregnant women. What is your stance about pregnant women getting MMR?
Right. So you can't get an MMR vaccine if you're actively
Oh,
pregnant. But there is a loose recommendation that if you're looking to get pregnant, to get your titers tested, because this is when antibodies really matter, is when you transfer them through to the fetus. And so I think that's an important distinction too.
Yeah, I think just to review, this is the most contagious virus known to mankind. And this is probably one of, if not the most effective vaccine known to mankind in terms of how efficacious with a single vaccine dose, ranges in the high 90s as efficacy. So this is really, and the other thing, just to add, this is a very unusual virus because it induces immune amnesia, so that you basically forget all the pathogens you were exposed to and all the, or at least a large proportion. So it's a very unusual virus. It hasn't gotten enough respect. And for the HHS secretary to say, oh, it'd be good to get measles is just ludicrous. So before we move on to other pathogens, I just want to make sure that the folks listening are on board with how the real evidence is that people who are vaccinated are protected, and what a great vaccine against such a nasty, horrible virus, for its contagiousness and what it can do in some people. Now, another thing that's out there, there's so many things, of course, Caitlin, is bird flu. It's still out there in like seemingly every cattle herd in the country, and so it has a huge reservoir. We keep seeing some little changes in the sequencing of the virus. So are you still feeling pretty good that this won't be pose a major threat, that we're not going to see this get big time human transmission?
I don't know if I'm feeling. I mean, as an epidemiologist, this is my job, right? So like, it does increase my anxiety. I don't think that means it needs to increase the anxiety of the general public right now, because there's really not much to do. Right now is the time to stop a pandemic, and so that's why you're hearing from virologists and epidemiologists of like, but like I mean, any given year, the probability of a pandemic is about 2%, because we always have spillovers and everything's happening. With this H5N1 situation, it's definitely increased it maybe to like 8% chance pandemic. That's not, it's small, but it's nothing like I don't want another pandemic, right? So like it's definitely something to keep an eye out on. And there's a few markers of which will increase um, are alarm bells as epidemiologists. One is that it starts spreading among pigs. Pigs are great mixing vessels, which these viruses can change very quickly. You're right, if it becomes more severe among humans, or if we start seeing more and more mutations. And then, of course, if we start seeing human clusters, we're just not that at all, DEFCON 1 yet.
Right.
And I really hope we don't get there, but
Well, we
flu has always been nasty, right? And if
yeah,
you asked epidemiologists before COVID what would cause the next pandemic, 9 out of 10 of them, or maybe even 10 out of 10 of them, would have said flu.
yeah,
So it's one we always keep a very close eye on.
absolutely. No, this is the top of the list, and we're not prepared for it. And we're going to get in a moment about what are we going to do about the massive tsunami of mis and disinformation that's holding us back, no less taking away resources at a time when we should be amping up, right? So the other one, of course, is COVID, which is at low levels at the moment. However, there was a variant seen in South Africa with 57 new spikes. It's a BA.3. It may or may not, have a role of bringing COVID to a higher level in the weeks or months ahead. Outside of that, it seems to be at this low level. What's your thinking about? Are we going to see further COVID waves?
I mean, we're going to see more waves. Like, COVID's not going to go away. I think the billion-dollar question is, what are those waves going to look like, right? This last winter was, I mean, COVID was definitely still there, but it was the most mild winter we've had. And so my epidemiologist brain is either there's two things going on. One, we just had a big summer wave. So we had a small winter wave, and we're going to have another big wave coming up. Or we're going COVID is starting to look more and more like its cousins, coronaviruses, that become eventually a common cold kind of thing. I don't think we're there yet. I think that it still needs a whole lot of immunity. I think COVID's also very different than other coronaviruses, but like, yeah, I don't know what's going to happen. And really, yeah, so we'll see where will this takes us, but it's still causing quite a few deaths in the United States.
Oh
It's
yeah.
causing a whole lot of disruption, and it's gonna be with us for a long time.
Yeah, I think to emphasize, at least the CDC is still doing genomic surveillance, and we're moving up higher with LP81 as the primary variant. But just because that variant isn't so difficult for us to deal with, as you are alluding to, we keep having a waning of the immunity that's been built, that we have built, each of us, and there will be some tougher variants that we'll be confronting. So the chance of having significant waves, maybe not as bad as we've seen in the 5 years of the pandemic, but certainly significant. And also, doing all sorts of things of hospitalizations, long COVID, no less the fatalities, it's still out there. Um, Flu is on the way down. That's good, I guess. It's a
It
really
is.
bad flu season. Are we missing any pathogens that we should have on our alert before we move over to YLE?
Norovirus.
Yes, yes.
Norovirus is having a year. Holy
Hmm.
crap.
Yeah, the
Norovirus
right
is,
word. Yeah.
yeah, it's this virus that causes, like, think diarrhea, throwing up. Like, it's this nasty, it is not a fun virus. Highly contagious on surfaces. And the test positivity rate has just continued to stay high. And usually, when this happens, it means norovirus mutated a bit. And so it's infecting a whole lot more people, but also just not a fun virus at all.
No.
And that's had quite the year as well.
Well, what was exciting to see was a week ago that there was a pill vaccine against norovirus. It's really
I
a
saw that.
And I wish that could go into acceleration because obviously that is a virus that's really causing trouble, and we haven't seen the last of it by any means. All right, so now setting the stage for what the pathogens are out there and at least some good information regarding measles and the others. We're at a very scary state with respect to who's managing this and the lack of evidence based for a lot of decisions or cutting major cuts. Today, we saw that there's a judge that wants to reverse all these federal people that have been let go, including the CDC, the NIH, FDA. I don't know. Of course, that could be a constitutional crisis because, maybe the administration won't listen to the judge or will just keep appealing to the Supreme Court. Who knows where that's going to go? But you have been an advisor to CDC, and you're very close to a lot of the people there. Uh, I don't know if you'd say they've been gutted, but a substantially reduction in force, right?
Yeah, I mean, there's a substantial reduction in force. And even, beyond that, there's a whole lot of fear about what's going on, what's the future of public health going to be, what's the personal implications of losing a job. I mean, and then losing a job and not having another job to go to because NIH is getting cut. It's a really, really tough and somber place right now. And I don't blame them. I think the other thing that's happening is people are having really tough decisions on, or discussions on, do you stay or do you leave? And what are the pros and cons to both of them? If you believe in a mission of public health, I don't know, so anyways, people are having really tough decisions to make right now, and a lot of moral injury. And I really worry about the public health workforce, not just today, but even a decade from now. It's
I
going to
mean,
hurt.
right, and even the ones who have been we're getting notes that they might get rehired if they abide by the judge's decision or the Supreme Court. They may not even want to go back because of the way things are happening with, each week to send your 5 things that you did and all these ridiculous things that are not the normal way that we do public health in this country or do biomedical research, of course. So that brings me to your efforts, which I think are really extraordinary. You think about this all the time. Seems like 24/7. How can we do better? And when we met just recently, you really taken some great steps for your Substack, but much bigger than Substack is the network that you work in. So besides the fact that now it's available in Spanish, and So you can get continuing medical education credit. I mean, these are great ideas. You have a staff now, a big team. I mean, my team is, one, but you have a team of like what, 14 people and some great people in your group that are helping to get the word out, get straight talk out. But you're doing other things too. So, in order to counter this situation we have right now, tell us about is it the Data or Evidence Collective and other aspects of your how we can counter the problems that we're confronting.
Yeah, I mean, we're very busy over there. And part of it is because of this information storm, right? There's falsehoods and there's true, like there, who do you trust and where do you go to? And I'll be honest and frank, I don't think a lot of the public health establishment is stepping up for this moment, and they haven't been even during COVID. And so I see a big gap to be filled. And it's been incredible honor to one land in people's inboxes. It feels very personal, and then two, to have this team. So we're expanding to other newsletters in different states. So we now have a New York YLE. We're going to do one in California soon, and then maybe Texas or South Carolina. And then you're right, I have a nonprofit arm of YLE, this enterprise, and a lot of that is figuring out how to equip trusted messengers, particularly in rural communities, as well as engage and collaborate and coordinate with other scientific communicators out there. Because if you don't, I don't know if you've noticed, but social media is a chaotic place to be at right now. And there's some really brilliant people putting out scientific content all the time, and figuring out how we can work together instead of reinventing the wheel is one of our big goals right now. And so, yeah, I'm busy over here.
Well, I'm trying to help you, find potential donors to support the effort because I think that's part of it. But let's face it, we've got Musk with X with hundreds of millions of people clearly in leaning towards one side of all this and promoting through that channel platform lots of the bad information we're talking about. Um, and so we have, besides the current administration that seems to not make a priority of good information and research and public health, we've got some big factors against us here. Do you think you have the ideas that if you could bring this network together and put out good information, can it ante up to this overpowering force that we're reckoning with?
I mean, it has to, right? Like, so I think right now we have to try things. And I've been frustrated on the lack of movement and urgency around this. And so I stopped waiting and I just started creating it. And we'll see where it goes. I think that it's hard to know what's useful without giving it a shot, and at least trying. And so you're right. This is where we're at. You're right. I've been fundraising for a very long time, getting very little movement. And so that's why I'm basically bootstrapping this with the support of Wiley subscribers. Is let's create this thing by ourselves, and
Yeah.
maybe one day people will see the value of it and hop on the bandwagon too. So, um,
With
you know,
this
I,
shadow CDC or alt CDC or
No,
what do
I
you think?
mean, I really don't want to be labeled as the resistance. I think what my biggest goal is to just provide information so people can make evidence-based decisions. Like, that is all. Like, if you decide not to get your MMR vaccine, but you have really good information, then so be it. But I
Right,
think
right.
that people are confused. They have a shitload of questions. There's a lot of anxiety, and people need questions answered. And people have really good questions. We just have to listen to them. And so that's that's where I am. And so, yeah, I may write about RFK Jr., but he's ignited a movement around better and healthier eating that's really resonating with a lot of Americans right now. So I don't
Yeah,
know. We'll see how this all plays out.
I do want to agree with you. I mean, I applaud that part of his efforts. That is
Yeah,
to deal with ultra processed foods, to deal with air pollution,
big
microplastics,
pharma.
big pharma. Those are good things. If
Yeah,
he only would stick to the science of vaccines and what we understand about diseases and health, outside of the food and the environment, then we'd be in good shape. But this is the real problem. It's the admixture of the things that he's wants to do that are laudable, taking on big food and big pharma, that sort of thing, with the unfortunate taking apart these public health agencies, which are critical to maintaining our health, especially when we're confronting potentially another pandemic.
yeah.
It could happen, and as you point out. All right. Well, this really is helpful. It's always good to get um, your grounded, anchored, well informed, perspective. What have I missed, Caitlin?
I don't. You covered it well, Eric. Thank you so much for having me.
Well, keep up the YLE. When we met,
Oh, we'll be here.
when we met, this is not just a couple of weeks ago when we met, but let's say it was over a year ago when, and you said, I don't know what we're going to do when COVID simmers down. It doesn't look like that's a problem now.
No, no. Public health is always going to be around. I think the biggest question I had was, can I pivot a newsletter to show people that public health goes beyond a pandemic and beyond infectious diseases? And so far, so good. So we'll see where it takes us.
Well, keep up the good work.
All right. Thank
All
you.
right. You
Thanks,
take
Eric.
care. All right.
Bye.